Okay. I'm Tasha McBride. I'm playing the doctor today.
I'm Sherry Garbez. I am playing the X-ray tech, MRI, and lab, and also going to be behind the camera.
I'm neuralgia. I'll be playing the patient.
I'm Katie Witt, and I'm going to be playing Lolali's daughter. Good morning. I'm Dr. McBride. How can I help you today?
I have pain.
Okay. Why don't you tell me about this pain?
I have that pain that starts from my jaw and that goes up to my eye, my nose, and that hurt very bad.
Okay. About how long ago did this start?
It started like 4 to 5 months ago.
Okay.
And that pain hurt, especially when I'm trying to eat, when I laugh,
Okay.
when I brush my teeth, it hurts.
Okay. So when you're using your face muscles, it tends to
Yes.
hurt more. Okay. Have you had any viruses or flu or anything in the past couple months?
Yeah, I have flu.
Okay. Have you been to the dentist?
Yes.
Okay, and was there any problems there?
No, that I know of.
Okay. Well, is it just the one side of your face or both sides, or can you kind of point to where?
Yeah, my left side, from here.
Okay. All right. Well, there's several causes that this could be. I think we'll go ahead and try and look at a couple of those. I'm going to touch your face a little bit to see if I can put any exact point at where this is happening. Okay. Does it hurt here?
No.
Okay, here?
Little bit.
Okay, how about right here?
What?
Okay.
Don't that.
So that hurts. All right, how about over here?
Ah!
Okay. Well, what it looks like you're experiencing is trigeminal nerve damage or trigeminal nerve neuralgia. And there's a nerve that comes out right here, and it runs to your nose. There's a branch down here and a branch over here. And does it seem like those are the places that seem to be hurting?
Yeah.
Okay. And you said there's no pain on your right side, is that correct?
No.
Okay. What I'm going to do is run a CAT scan and an MRI and a blood test just to rule out any possible causes or any pressure that could be on the nerve. And then we'll get those back and see what we can do with those results, okay?
Okay.
All right. We'll go to the lab then. All right. Hello, Miss Sherry.
Hi.
I've got Lolali here. I need a CT, an MRI, and a CBC on him.
Okay.
And as soon as possible with those results, okay?
All right.
Thank you. All right. Well, I've got your test results here. Looks like there's no nerve compression or any vascular abnormalities that are putting pressure on that nerve, so it may just be an overacting of the nerve itself. Your CBC also came back clear. There's no indications of any kind of cancer either that could be building up and pushing on it. What we can do, I do think it's the trigeminal neuralgia, and here's a pamphlet on that, and there's some places on the back too that you could also call for people who specialize in this. We can start you on some medications. The ones I would like to go with is baclofen and dilantin. And one is typically an anticonvulsant and the other is a muscle relaxant. And that will help decrease the cause of the pain with the nerve. And we can try that and see in about 2 weeks, see how that's working for you. And if that doesn't work, that's the least invasive, although those medications do have their own side effects, fatigue, dizziness, stuff like that. Or we can try some injections, some electrical nerve stimulations. There is a balloon there. We go in and open that up a little bit.
No.
Okay.
I don't want no surgery.
No surgery, okay. Because there is a surgical option that I just have to tell you about.
No surgery.
Okay. Well, then I'll go ahead and get you with the prescription for the medications and see you in about 2 weeks. Is there any other questions that you guys have?
I have questions.
Okay.
Is this disease hereditary?
Not typically, no.
Okay, good, because he's got like 16 different kids
All right.
and 5 different wives, and I just didn't know if I had to let anybody know.
We also have a birth control clinic.
Thank you for exposing me to everybody.
I'm sorry, Dad.
Down
but,
the street, so just in case you're interested in that.
What about any special treatments for him?
Well, like I said, the treatment that we have in case the medication doesn't work, you can take the Tylenol or ibuprofen for pain if you are still having the breakthrough pain. Just be light, brush your teeth light, do, your shaving lightly, don't, overstimulate that nerve. Try and eat on the unaffected side. That way you're trying to use that nerve the least amount as possible. Any other questions?
Pain. He's in pain all the time. So is what you're giving him, is that going to help with his
Hopefully
pain?
these medications will help decrease the cause of the pain. And like I said, if you do still have the breakthrough pain, Tylenol, ibuprofen can be used. But if it is bad enough, we can get you some narcotics, maybe some hydrocodone or something like that, okay?
Okay.
All right, well, we'll see you in about 2 weeks then.
Okay, thank you.
Thank you. Okay, so it's been 2 weeks. How is the medication working out for you?
It's not working that great. I'm still having pain like a couple times in a week.
Okay.
It's not working.
Okay.
What can you do for me?
All right. Well, like we mentioned earlier, you said you don't want the surgery.
No.
Okay. Well, we can try different medications or the electric nerve stimulation.
No electricity. I'm scared of electricity. No.
Okay.
No way.
All right. Well, we can look at the injections then. We have 2 different kinds of injections. One is an alcohol injection. It's just beneath the skin there, and it kind of puts a block. It numbs the face a little bit and numbs that nerve. So you will have some numbness and tingling with that, and it lasts for a few days to months depending on the patient.
You're gonna put some alcohol in my nerve? No way.
Okay, well, we do have a glycerol injection, and it lasts typically a lot longer, and some people don't have to get it again, and some people do. It does have less facial numbness. The pain may reoccur, it may not. There's maybe some tingling, but we go in we x-ray vision it and go into the nerve and put the glycerol in, and it blocks the pain stimulation. But your pain will be resolved for quite a lengthy time with that.
Is there any side effect?
The numbness and tingling is a possibility with that, but that seems to be really the only long-standing side effect of it.
You don't have any other option for me?
Well, we could try and change your meds again, but...
And you're not willing to do surgery.
No way. Katie, I told you no surgery.
Well, I'm just saying it's an option, Dad.
Okay, well, the injections do have pretty good results.
Okay, try.
Okay, would you like to do the alcohol? With the alcohol, it can last less of a time. So would you rather do the glycerol injection?
I go with the glycerol.
Okay. All right, we'll do that. and I'll go ahead and, do you have time for that today?
Yes.
Okay, we'll get you scheduled for that, and then I'll see you in about another week and see how that's working. Does that sound okay?
Yeah.
Okay, any questions?
I don't have any today.
Okay, all right, we'll go ahead and go over to the lab then. Okay, Sherry, we're back. This is Lil Ollie again.
Okay.
We're gonna do the X-ray guided glycerol injection to the trigeminal nerve left side,
Okay.
and then we'll see him again in about a week.
All right.
All right,
Welcome
thank
in
you.
and have a seat.
Okay, so it's been about a week. How are you feeling?
I'm feeling better.
Okay. How is your pain on a 0 to 10 scale?
I give it a 2.
Okay, and tingling, numbness, anything
Just
like
light.
that? Just light? Okay, well that's good. This seems to be working for you then. Hopefully it'll work for a while. Is there any other questions or any problems that you do seem to be having?
No.
Okay. Well, if you do, we can try one of those medications in comparison with the treatment that we gave you, maybe the baclofen or Dilantin or maybe possibly Neurontin, if you do start to have the pain again. It would probably be milder, but putting a complementary medication with it would probably be helpful. Is there anything else that I can help you with?
Can we just prescribe me the Dilaudid now?
Okay, I can give you a prescription. See, the Neurontin needs to be used on a basis like an everyday, so it can build up, and you can't really, like, you know, I have pain once a week and take it that one time a week that you have pain. It might help slightly, but you wouldn't really reap the great benefits for it. Would you rather have?
Don't need that now.
Would you rather have maybe prescribed pain medication?
Yeah, Kelly, you're not having the pain.
But
I'm
you
having the pain.
are being dramatic. You are not having that much pain, Dad. I'm at home with you all the
once
time.
or twice a week, even if that's a slight pain, a pain is a pain.
Then
I need that Dilaudid.
Do what you want.
Okay, well, we're not going to go with Dilaudid, but what we can do is go with hydrocodone and about a 5-3-25, and we'll see how that works. That should relieve any subsequential pain that you do have.
And
Does
you
that
can't
sound
just
okay?
pop these things like candy.
Okay.
You know, only if you're having pain.
Kelly, I'm your dad. Have some respect, please.
All right. Well, is there any other questions?
No.
Okay. Well, if you have any more problems, just contact our office.
All right.
All right.
Thank you.
Thank you. Play.
I know on that other side.